All right, our first guest, he's got a book out. It's called Salt, Black America's Silent Killer. I've been in health nutrition all my life, and this guy knows what he's talking about.
Yes.
You think as long as I've been in the health nutrition and studying it and reading about it, my own family would listen to me, but people don't listen. So please welcome my first guest, first time on the Rob Dennis Show, Dr. Surender Neravetla. Please make him welcome, everybody.
Hello.
Hey,
Good to see you. Thank you.
Good man. Boy, do we have a lot in common. I tell people your goal in life, doctor, is to exercise moderately, eat properly, watch your salt, your sugar, the amount of grease you're consuming. Salt, Black America's silent killer. You want to, guys, get ready, and I'll just mount this right here, and whatever camera you guys can get to take a picture of that. We all know the salt is bad for us. Doctor, why isn't America listening?
I don't know, Rob. I hope you can tell me, but I know for a fact that they're not listening. Just about every healthcare organization in the entire world telling people to cut back on salt. But you and I know when you go to a restaurant, just right next to you, people putting salt even before they taste it.
Sure.
So I figured out that it's not that they don't know or they have not heard, but they have not been able to connect to that really. So we wrote this book, Salt, Black America's Silent Killer, to explain how many different ways salt hurts you in the simplest of the languages. That's what we did.
Now, I read years ago that African Americans had a much higher rate of stroke and heart attack because of their diet. But then I heard the trend is now getting better, that we're all being educated. I mean, my grandmother, she didn't know what you and I know.
Yes.
I can still see her gnawing on that greasy pork chop bone. She passed away at 63.
Wow.
In America Day, 63 is a child.
Yes, it is.
That is
In
a
fact,
young
it is.
age when it comes to what we're consuming, because we didn't know then. And now I think we're getting much better education is going on in our schools.
Well, the overall health of the entire nation is seemingly getting better. We are living longer, including the Black Americans. Mm-hmm. Unfortunately, we are not living well. Mm-hmm. The last 20, 30 years of our life, we are paying the price for all the bad habits we've had all through our life, especially smoking and salt. And salt and smoking are just about equally dangerous, 1 and 2, depending on who you ask. There are so many health problems that salt causes. And by some counts, it actually is the public enemy number 1. It does more problems than smoking even, actually. I'm not saying smoking is okay, but these are both equally just as bad. So we need to pay attention to salt, and that's why we are writing these things.
But they're sure not cutting back on the cigarettes in America, because there's so many people earning a living on cigarette revenue. And it's killing Americans.
Yes, it is. That's the same story with salt. There is not much education about salt because there's no money to be made by educating people about salt. There's a lot more money to be made by selling you a high blood pressure pill or a statin pill and things like that. But there's no money in educating people about dangers of simple things like salt and smoking. We are spending billions, if not trillions, of dollars on finding new ways to treat and give more medications, pills, and procedures for things like high blood pressure. But we are not spending hardly any, pennies, if you really count it, in prevention, especially in Black America, which is much worse affected by salt than the rest of the world.
And less salt, a lot of these problems, I'm sure you'll agree, would disappear, the high blood pressure, just by eating a proper diet.
Well, salt, definitely causes many, many, many health problems, from one extreme to the other extreme. But you talked about high blood pressure just now. High blood pressure is just one of the things that salt causes. There are many other things. The children get asthmatic attacks. Middle-aged people in Black America get renal failure and dialysis. And as you get older, you talk about high blood pressure, strokes, heart attacks. And you get older, dementia, osteoporosis, and you're disabled. You just mentioned about living longer. We're all living longer. But my concern is, are we living well? We are not living well. That is the point.
Well, I'm sure. Where can they get this book again, Doctor? Tell us where we can get
This
that
book you can get, we have a website, saltkills.com, saltkills.com.
Saltkills.com.
You can go there. In fact, we write a blog once a week. You can check it out. You can get it through our website. And you can also go to amazon.com, and the book is available in a Kindle format. You're talking about smartphones earlier on. iPads are very popular. You can download it on iPad, or you can get a paperback. So it is available in all formats. And it's a non-profit venture, by the way. This is not for making any money. We just to educate people.
Well, when I buy my seasonings, like we all love garlic, I get garlic powder. Every seasoning I get the powder. If it says salt, it's out.
I would encourage you to take it a step higher, really. If you have to read a label, maybe that's not something you want to eat in the first place.
And you can't pronounce what's on the label.
On the label.
Okay.
So
I know what it is.
we talked about how bad salt is for Black Americans, but about 30% of Caucasians is just as bad. So everybody should avoid salt the best you can. And buy the lowest salt-containing item you can buy. But I would say more importantly, try to find ways to not put any salt on any of the foods that you eat the best you can, actually. That's a better choice.
Natural seasonings.
Natural seasonings. Try lime, lemon, herbs, and various seasonings. But more importantly, just take a look at my book. If you read my book, all you guys, take a look at this book. Once you flip through this book and just see all the pictures and stories and graphs that we put in.
You've made it simple.
Very simple. It's it's like a Dr. Seuss Cat in the Hat type of book. It's written at a very simplest of the languages. I can tell you from my own experience that once you go through this book, even customary, casual look through this book, you will pay attention to your salt intake. I guarantee you that. So try it out, you guys, okay?
Well, I'm not going to mention any names, but somebody in our control room is addicted to salt. So I'm going to give that person this book. So I'm going to make sure that person, which shall remain nameless, reads this book. Thanks for coming.
Thank you very much, Rob. I appreciate that.